Hello everyone, good afternoon to all of you. Thank you for joining us again for another episode of Doctors Go Live on Columbia Asia Facebook. Okay, today we will be talking about breast imaging. Although it's not breast cancer month, but there is a reason why we still have to address breast imaging or breast health in particular, because it is very important. And to explain to us about this topic is Consultant Radiologist from Columbia Asia Hospital Bintulu, Dr. Khor Foo Kiang. Hello, Dr. Khor.
Hello, good afternoon, everyone.
How are you today?
Yeah, I'm fine. Yeah, hope everyone is fine. Yeah.
Thank you so much for making time to be with us today. Okay, first of all, let's take a look at the topic, the official topic of today's talk. It's very intriguing. What the eyes don't see, what the brains don't know. So what does it actually mean? Maybe you can.
Usually we like to use the brain. The brain doesn't know, the eye don't see. That means if the doctor don't have adequate knowledge, they will never able to pick up the abnormality during the examination of the patient. In the breast imaging, it's vice versa, because if you unable to detect the abnormality in the imaging, then you will never know what's happening in the breast. So that's why I give a topic today. The eyes don't see, the brain doesn't know.
Yeah, it's very cute, very creative of you. Okay, first of all, okay, you already explained just now that this is regarding breast imaging lah, and I'm sure it's very important that now, even in December, we are still on the topic of breast cancer. Why is this important? I mean, it's not time sensitive, of course, it's a disease, but maybe you can explain a little bit about the breast cancer situation among Malaysian women.
Compared to 10 years back, cancer is only, the age will be a major consideration. If we want to make the cancer, colon cancer, breast cancer, thyroid cancer, is no longer a good indicator for us to spot whether it's a cancer. That's why here in Bintulu, I noticed even the women aged around 30 to 40s, we do pick up some lesion which is need special concern for us to rule out it's not a breast cancer. So that's important for us to detect it early, because detect earlier, definitely the treatment will get a more effective. It will be better effect.
Yeah, is 30 to 40 a considerably young age for someone to get breast cancer, or that's common?
Yeah, that's why we do have a criteria to stratify the risk of the breast cancer. For example, do you have a first degree family, like your mother, sisters having breast cancer, diagnosed breast cancers? Okay, if you have a strong family history, then you need to be careful, especially this where BRCA1, BRCA2 gene. Okay, need to be careful. Second is like if you are single, you have late menopause. Okay, you have a prolonged exposure of the menstruation, you need to be careful also. So there's a risk certification for us to give the assessment. Yeah.
Okay. So this is why breast imaging is very important. Maybe you can go ahead and explain about why breast imaging is necessary.
Nowadays, breast imaging is quite straightforward, because now we change towards screening test rather than wait for the problem. Because we have two kinds of imaging for the breast imaging, two purposes. One is screening purpose. That means the patient might be asymptomatic. We might not call them patient. They are from a general population. But another group is like they have symptoms. Like, for example, very common is that they feel painful during menstruation, or they have some discharge from the nipple, which concern them. But actually, this group of patients, majority will be normal after the screening. So this why normal is important for them, because this will be reassured them. There's nothing need to be worried. They can be reassured, and they will have a quality of life, because they no longer need to worry about the symptom they experience. Another group will be the population which feel the abnormality, like for example, they feel the lumps, or they have the discharge which is abnormal, for example, blood stain discharge, or they need very serious concern because we need to really get thorough assessment on this kind of this group of patient. Okay. So next, I will go to the type of the breast imaging. For general rules, we will tell the population, if you are less than 40 years old, you can come for screening, not a problem, but we'll do an ultrasound screening for you. Okay, and for the patient with who are more than 40 years old, we will recommend mammography with or without complementary ultrasound. That means after the mammogram, we will see go through the film. If we think we need to do further ultrasound, we will on spot do another ultrasound for you. Okay? So this is a general rule. But usually the radiologist will tell you further tally accordingly, recommend accordingly on spot. Okay. Yeah. So
Dr. Khor, is there a specific reason why sonogram is recommended for those above 40 years old and why mammography is recommended for those below 40 years old?
Extend further in the next few slides. Okay. Next. Okay. So mammogram, for information, mammogram is it's an X-ray. I like to use the term of X-ray examination on the breast. We need to do a mammogram on the breast is to detect the calcification in the breast, which is very early sign of the breast cancer. Usually, if the patient don't feel any lesion, but they only see the calcification after the mammogram, it's usually we call it carcinoma in situ. It's not yet stage 1 cancer. So it's very important for us to pick up this kind of the abnormal calcification. But I'm sure every study has a limitation. So for women less than 40 years old, mammogram wouldn't help you that much. I will explain in the next slide. Okay, next.
Okay.
Okay, so this is the slide for you. Okay, on your left hand side, okay, you will see these three are the mammogram of the three different ladies. Okay, so on your left hand side, okay, usually this is very bright, bright film. Okay, we call it dense breast because when women aging, okay, the hormone, the female hormone in the body will start to reduce. Okay, so
Right.
at the age of the 50, you'll notice the difference compared to the left-sided mammogram is the whitish part is become lesser. Okay, and when you go to the right-hand side mammogram, you notice it become more darker. Okay, at the age of 60 because the hormone already reduced. By the age of 60 years old, usually women will be menopause. So the hormone level will be reduced. Also, this we call it a fatty breast. Okay, the left hand side we call it a dense breast. That's why dense breast doesn't give you any information. Because next I will explain to you next. Okay.
So, Dr. Khor, so these are normal breasts, what we're looking at.
Yeah. These three are the normal breast. Yeah,
Okay.
at the different age group. Okay.
All right.
Okay. Yeah. Next. Okay. So the left hand side is a very dense breast, as I showed you in the previous slide. The right hand side is a fatty breast, is very dark. Okay. So if you look at the third, the middle mammogram, okay,
Yeah.
you notice there's one big white spot. Yeah, over there. Okay.
Yeah.
Why we can see this easily? Because this is a middle age or more advanced age group mammogram. Breast, we can detect this kind of thing very easily. But you imagine if this lesion is in the very dense breast, it will be shadowed by all the breast tissue. Yeah, so that's the reason we recommend young age group population to go for ultrasound. Yeah.
I
So
see. So what we're looking at now, is mammogram results, lah.
Yeah. This is a mammogram of a breast cancer patient. Okay. I will show you the ultrasound features of this breast cancer. Yeah.
Okay.
Next.
So you're saying that those who are younger than 40, you can't really see because of the makeup of the breast, lah, dense tissue.
Dense tissue. X-ray cannot penetrate dense tissue. That's why
Oh, I see.
Ultrasound. This is the image of the ultrasound. Okay, so
Right.
we see one big lesion, dark color lesion with all the vascularity. Okay, for your information, the orange color part is the blood vessel. You can see the blood vessel. Why breast cancer will draw a lot of the blood vessels surrounding it or within the lesion itself? Because actually it will how to say, we call it neovascular genesis. That means it will develop a lot of the new abnormal vessels surrounding it or within it to cause the body to supply the nutrients, to supply the oxygen for the cancer. That's why the cancer usually one of the very common features is grow very fast, because it have a abnormal vessel to call your body to supply the oxygen and the nutrient for it to grow
Good
fast.
thing. Okay. So that's actually the body's defense system.
Yeah. Actually, normal defense system supposed to kill the initial cancer cell, but once our body immune system cannot cope, then this lesion won't be killed by our body itself.
Mm. Okay.
Yeah. Yeah. So next, I will show you some advantage of doing
Ultrasound.
ultrasound. Yeah.
Okay.
For information, ultrasound we do use it to screen, to scan for the baby, also for a pregnant lady.
Yeah.
So this is the advantage of the ultrasound. Is no radiations. You no need to worry, because some of us worry radiation do cause cancer. So it's a kind of a paradox, You come to do imaging to detect cancer, but you worry that study will cause you cancer. So ultrasound is totally safe, because even during pregnancy, we use it to scan the fetus. So it's zero radiations, no need to worry. It's
That-
100%. Yeah.
Is that the feedback you get from your patients who are skeptical about going for ultrasounds?
Yeah. Usually I will explain to them. You can
Mm.
repeat ultrasound every year. If you worry 6 monthly, also it's not a problem. But we don't recommend you to repeat mammogram that frequent, because there is a radiation involved. That's why you need to come to us. We will tell you, we will recommend you what is the next step after the imaging.
I see. So
And
mammogram has radiation because it's X-ray, and
yeah,
ultrasound does not have radiation.
yeah. These are the main difference of the these two studies. But
Okay. Is it the same machine though?
sorry.
Ultrasound, is it the same machine used in the
No,
gynae
it's a
office?
different machine. It's a different machine, which I will show you in the next two slides.
Okay. Okay. All right.
And ultrasound, actually, this also have some advantage, because we can access more detail regarding the lumps, which we detected the mammogram. Okay,
Yeah.
so it's a kind of a complement study for us to investigate further the abnormal area we see in the mammogram. So it's a very good for the women, for the lady with the very dense breast, which is below 40 years old. But the difficult part for us, limitation of the ultrasound, is we cannot pick up microcalcification. So there's a reason after 50 years old, after 40 years old, we will recommend mammogram to do 1 or 2 times mammogram to see any microcalcification which we might miss in the ultrasound breast. Yeah.
So it's not that one machine is better than the other. It's just
No.
depends on what you're
Yeah.
looking for.
Yeah, usually I would say both of them work together is give the best outcome. Yeah, and definitely ultrasound can work by itself, okay, but because of the limitation of this, we will recommend to do both after 40 years old. Yeah.
Okay. So your recommendation is in order for patients to get a comprehensive
Yeah.
detection, it would have to be both, which is available at Columbia Asia Hospital Bintulu. I'm sure
Yeah. Yeah.
just
Yeah.
for both. Okay.
Yeah. Yeah. I
All
will
right.
show you the next is the machine. Okay. Okay, this is the mammogram machine. Okay, on the middle there is the pedal which we will use to compress the breast.
Yeah.
Some wonder why we need to do for compression of the breast. It's painful, not pleasant. But there's a reason why we want to compress the breast before we give a radiation to catch the breast, because once we compress it, the breast will be immobile. You won't able to move. So when you shoot the X-ray, we will guarantee very good quality of the film or the X-ray film. Second, okay, once we compress the breast, it will from 3D compress become 2D. So we can reduce the radiation. We don't need to radiate that much. Actually, we don't compress, we can do X-ray. We still can see. But what's the price we pay is like we need to radiate a lot, much higher than we compress it. So this is the reason we will do compression during the mammogram. Yeah. Some might not comfortable, but please, once you feel not comfortable, you tell the staff will stop compressing. We will proceed for the mammogram subsequently. Yeah.
Yeah. Dr. Khor, mammogram has been around for the longest time compared to ultrasound, right? I mean, ultrasound is only, it's been around, but mammogram was the first machine for breast cancer detection. Would you say that?
Yeah, I would say that. Yeah, because mammogram, I go and Google this one X-ray of the Roentgen wife X-ray with the Roentgen invent X-ray and took her wife hand to X-ray. So X-ray is much earlier than ultrasound. Ultrasound is very new technique. I think over these 20-30 years, advanced imaging. Yeah. So I will show you the next is the ultrasound machine. Okay, this ultrasound machine is the same machine we use to scan the baby. So you will feel nothing, no uncomfortable. Okay, you won't feel uncomfortable, and we will keep your privacy. Or maybe we will keep the privacy. You will no need to worry anything you feel not comfortable. You just tell the staff we will keep a very good privacy for you during the scanning time. Yeah. Okay, we go to the next slide. Okay, so now if usually how we classify the abnormality or how we give you the report after the ultrasound or after the mammogram. Okay, I like to use this kind of the my layman term. Okay, we will give a marks. 0. That means no mark. You need to come back for a test again. Yeah, your mark is 0, so you need to get some mark, for you to satisfy. Okay, so 0 that means it's not adequate. You need to count for either ultrasound usually. That means you do a mammogram, dense breast. Okay, you get 0 mark for that. We cannot give you a mark, 0. So
I thought, sorry, Dr. Khor, I thought you meant like 0 means the best because there's nothing wrong with you. So 0 is not it. 1 is normal.
Yeah, 1 is normal. 1 is normal. That means the best mark is 1. 0, that means we cannot assess you. Not enough mark. Yeah, so we'll call you to come back for additional imaging evaluation. That means we will do ultrasound usually and we'll tell you normal or not normal. So once you call you, there must be some reason we call you to come because you perhaps get the BIRADS 0 classification, the grading. Okay, so
these two are for mammogram and also ultrasound lah.
Yeah, both also we give this BIRADS classification. So if we see something, okay, usually breast imaging one I like to use it. You see something solid or you see something fluid. We call it cyst. Fluid also have a lesion which is good. We call it benign. That means it's a good guy. You don't need to worry. Okay, or perhaps it's a good guy. You say probably benign. That means you go to shopping, all the places full with guys. You don't investigate everybody. But perhaps you will see 1 or 2 garang sikit nampak macam orang jahat you will worry. You see them outside your house. Wow, I saw some man, look so angry looking. It's kind of the suspicious. You need to investigate. This kind of the man. Because they threatening you, life threatening. I call it. So another there's a BIRADS 4. We call it suspicious. He looks suspicious. Better call somebody to investigate. This guy. Okay. Number 5 is definitely you look somebody from just come out from prison. You will know, this is bad guy, but you just don't know this bad guy, how bad is it? So perhaps you can call somebody to investigate the background of this bad guy, isn't it? Number 6, after you take the tissue, you send to the lab to examine. Oh, it's confirmed. This is cancer. This is a confirmed bad guy. This is what I say. So usually we recommend, okay, for the benign, that means it's a good guy. Okay, number 3 is that good guy facie. Look good, but we don't know, no? Maybe look good doesn't mean good. Okay. Also, we also follow up you for the BIRADS 3 lesion. We will scan back after 6 months usually. But for the BIRADS 4, that means it's a look like bad guy. Okay, number BIRADS 5 is the bad guy, but not yet proven bad guy. We need to do something to prove whether they are good or they are bad. So this is the tissue biopsy will come. We'll do further investigation. Usually we will call you to see a surgeon first to document everything. They will further ask you some history. They will examine you. They will open a folder for you. Then they will come back to us. We will discuss again. Then we will decide what to do next. Yeah.
Okay. So number 6, of course, is
Proven bad guy.
already.
Yeah. Yeah, it's a proven bad guy. Okay. So I will show you a few lesions which we commonly see during our breast imaging. So breast cyst is a lesion. It's something the lump which fill the fluid. Only fluid. But complex is something other than fluid. There might be some solid component. There might be some separation. We call it. I like to use a slaput. When you fry the egg, you break the egg out inside got the slaput. We call that as a complex breast cyst.
Okay.
Yeah, they need further investigation. So another type is a fibroadenoma. Fibroadenoma is very common in the women population. So this fibroadenoma is considered as a BIRADS 2 lesion. That means it's we see something, but it's a good guy. It's a good guy or good guy facie. You don't need to do something. You just need to follow up yearly or 6 monthly. But for the breast cancer, automatically it will fall under suspicious or BIRADS number 5.
Fibroadenoma is basically fibroids,
it's considered fibroid in the breast. It's derived from the normal tissue. But it's something you don't need to worry. You just whether fibroadenoma can become a cancer or not. No, you should know.
I see. Okay. So breast cysts are basically harmless, and fibroadenoma could be harmless and could be dangerous.
Because sometimes some radiologists like to use atypical fibroadenoma. It means one feature, all the features, good guy, good guy features, but only he has one bad habit. So they say atypical good guy. One features is not good, but to me, this is your body. I won't tolerate one features of suspicious and we let it go. Yeah. So my advice is even one feature is show perhaps a bad guy, we better do further investigation. Yeah. Okay. So we will go through some lesions.
Why do we call it common? Why do we call it lesions? Breast lesion.
Lesion is we call it tumor. Tumor is usually we use more than 4 cm. We store something more than 4 cm, we call it tumor. But lesion is something
fibroids and cysts.
So lesion, that means we lump and bumps. But lump and bump is less than 4 cm. We will say it's a lesion. But lump and bump more than 4 cm, we will use it as a mass. It's a tumor already. So there's a difference we use in our reporting. So this is a breast cyst. It's a simple breast cyst. Okay, you see in the image. This is a dark color, oval shape, well circumscribed region. Inside this is empty. All are dark color. So this is very typical. The called simple breast cyst. No need to do anything. The risk of turning cancer is 0%. So we reassure you, no need to worry. So you can do a yearly ultrasound follow-up on this. Okay.
Yeah. Dr. Khor, as a radiologist, would you be able to tell whether the images are telling you whether it's cyst or fibroid or breast cancer on site?
Can,
Like the
yes.
minute you look
Because
at it, you already know what it is.
yeah, because in ultrasound, usually fluid will be appear as dark color. Dark color as outside the frame. You see, outside the picture is also dark color. So
Yeah,
this is confirmed is a cyst, it's a water
I
content,
see.
it's a
Ah,
fluid content. Yeah, so this is guaranteed. This is a cyst. Okay, if we go to the next slide, okay, this is the complex cyst. What's the difference? You see, it's not entirely well shared. It's not an oval shape like just now. Inside
yeah,
they got some whitish band inside. We call it
right.
as the septation or sclaput. Is the septation inside. This kind is a complex breast cyst. So we see a complex breast cyst. Usually I will start to ask you some question. Do you have a family member having cancer? Okay, what about you yourself? Do you have any previous history of cancer? Okay, it's also very important. Okay, and this lesion causing you any symptom or not? Usually asymptomatic, we can wait. But if this lesion cause you pain, discomfort, discharge, or you feel a lymph nodes, lumps at your armpit, this is also something you need to be attention, and I will suggest further investigation on these complexes. So it's not we saw one thing, immediately we do something. No, we will use another risk stratification table. We will start to ask you. Then we decide this you want to take it out or not. Okay.
All right. Sorry, doctor. I just want to let the audience know that if you have any questions, you can just type your questions in the comment section below, and we will answer the questions on the spot.
Yeah.
Okay.
Okay.
Carry on, doctor.
Okay, come, we go to the next. Next, I will show you the fibroadenoma. Okay, you'll notice this is more brighter lesion or brighter lumps compared to just
Yeah.
now. Just now is totally dark color. But
Mm.
this lump is brighter color. Okay, it's
Yeah.
also oval in shape. Okay, so this is very typical fibroadenoma. We will reassure you. No need to do anything. Because usually I will say, if you want to do something, can, no problem. But there's also always risk of the procedure and risk of the operation. The risk of the giving you some anesthetic agent, you might be allergic to it. Okay, so why you need to investigate this who doesn't look bad. This is what I say. We say investigation can divide into two. One is invasive, one is non-invasive. Invasive, that means we need to cut through your skin, put something inside. This is called invasive procedure. Another investigation, so-called non-invasive procedure, it won't harm your body, it won't cause bleeding, it won't cause infection. Okay, so ultrasound and mammogram is non-invasive procedure. That's why we do recommend to all the population to come for the mammogram and the ultrasound. But for the invasive procedure, which I will explain later, that we only recommend to the certain patient only. We won't recommend for everybody. Okay.
Doctor, just now you mentioned that cyst contains liquid. What about fibroid?
Fibroid is a solid. It's a actually it's a normal tissue. It proliferate from one lump. But it's a normal tissue of it. You take it, you send to the lab. Actually, they will report back to you. Actually, it's a normal tissue which proliferate, it become a lump. That means they don't see any cancer cell inside this kind of the fibroid. Yeah.
Okay.
Okay. Okay.
Right.
Next we go to the we wonder, is this a fibroadenoma? Usually, I explained at the initial of the talk. Okay, what's some vessels? That means these lumps having some feeding. Get your feeding from the body. The blood supply it. So, like I mentioned just now, all features look okay, look like a good guy, but one features, yeah, suspicious, Although he look good guy, but one features show you this might be a bad guy. We will still say some like to use atypical fibroadenoma, but I usually I like to explain to the population. I say, why you want to put a time bomb inside your body? If this time bomb, isn't it? If you investigate it, this is normal. It's a fibroadenoma. Everyone happy. Everyone will feel relief. you won't worry for the next few months or years. But if this is something not good, usually I say, if this come back as not good as a cancer, you will feel grateful because you detect it much early, at the very, very early stage, rather than you wait until 1 year, 2 years later, it come back as a bigger lump. By that time, it will be stage 2 or 3. Yeah.
Yeah.
Yeah. Okay, so I will show you the other picture. This is also is an atypical fibroadenoma, which we investigate and it's proven actually is a breast cancer. It's not a fibroadenoma.
Oh, I see.
So yeah, because
What's
the
the difference?
yeah.
Like I know radiologists would know once they see image, but I mean, if you were to explain it for the rest of us, I suppose you see this as a fibroid based on your explanation earlier. But what makes you say that this is breast cancer?
Because usually if you take out a pencil, you can draw a overshape, okay, very clear overshape without doubt. Then this is usually fibroadenoma. But you take out a pencil, you want to draw, I don't know where's the border, some part look blurred out. Then this is something suspicious, and you see a lot of the vessels, the blue color, the red color surrounding this. So this also is a suspicious features, compared to the fibroadenoma. Yeah. This need
You mean usually the blood vessels will be there?
No, usually fibroadenoma, you click it, you take out a pencil, 1 second you can draw overshape. Another, there's no clear cut, no vessel. Even with one small vessel inside it, some of the consultants will recommend you better further investigation. Yeah.
But our breast, there are it contains what do you call it? Blood vessels, right? The breast itself.
But itself, yes, contain blood vessel. If there is no, we don't see any lumps, it's not normal with the blood vessel, then there's a normal blood vessel. But if with the surrounding, then this is not considered a normal vessel. We will proven this is abnormal until the histology, the lab people tell you, oh, no worry, this normal. Then we will stop our investigation. Yeah. Okay. Next, I will show you some program at the early of the talk. Okay, which you will see. CC means we will compress the breast up and down. Okay, so it will become a CC form. Okay, our MLO, that means we will rest your arm. Okay, we will compress that side to side. So this is two views. So will help us to see very clear cut. You can see the RC at the middle there is a one big very whitish lesion, the lumps there, which you also see in the RMLO, at the upper part, you can see. Okay.
They're looking at the same pair of breasts.
It's a R is the right side.
Angle.
Yeah, just the angle is different. The right side, L is the left side. Usually you put together to compare. Compare.
And then top and bottom.
Yeah, top and bottom. CC is top and bottom. Okay. All is side to side. Yeah.
So the image on the left is right and left, and the right is top and bottom.
Yeah. On the right hand side, we put right breast and the left breast together to compare.
Okay. On the right hand side is left and right breast. Okay. So left hand side is top and bottom.
Yeah, top and bottom. But we put together to see whether we call it symmetrical or not. That means there's no difference. Yeah, left and right look almost the same. We call it symmetrical. Right.
Yeah.
So next, our ultrasound for this patient, you can see so much different to earlier slide. The earlier slide is that you can draw an overshape, or there's no much vessel, but this is we so-called angry looking lumps. This is angry looking look. Wow, look, you scared of angry person, so you scared of the angry lesion, we call it, angry lesion, look angry, sedang marah ni, so you say, oh, better be careful, cautious with the angry person, okay, not smiley person, okay, also we must cautious with the angry lesion, okay. Okay, so
why do you call it angry again? Because it's all over the place compared to the one that you showed earlier?
That means all the vessels is the angry features, like it's a friend,
Because there are many vessels.
Yeah. Okay. So if you have a BIRADS 1, normal, BIRADS 2 is a good guy lumps, okay? BIRADS 3 is a look like good guy lumps, okay? We will recommend you to do a follow-up ultrasound, no need to do any investigation. But for the bad guy lumps, okay, this is a bad guy lumps, okay, you need to do further investigation to investigate it. In real life, you make a call to police, or you call your friend asking this guy what's the background of this guy. But in our medical field, in the breast imaging, what we do, we will take a needle to take some small tube from this lesion, these lumps, and we send this for the investigation. The lab people process it, and they will see under the microscope to tell you this is a bad guy or this is a good guy. And at the same time, for example, this lesion, definitely this is a breast cancer, no doubt. But we need to take this lesion, because we want to take the tissue to scan for certain gene, abnormal gene. We call it BRCA1, BRCA2, and another is what? Another is whether we want to see this lesion is the hormone sensitive or not. Some are hormone sensitive. They have a receptor hormone sensitive. We will give a anti-hormone treatment therapy to shrink this cancer. Yeah. Okay. So we go to the next. Okay. Next slide. Okay. So we have two kinds of the investigation. Okay. We usually do the ultrasound. We do a scan at the same time. We take a small needle. We will give you a painkiller. Once you feel numb, no longer pain, you start to do. Take a very small needle. It's a blood taking needle. No worry, it's not a big needle. It's a blood taking needle. So we will, we will do an ultrasound. At the same time, we will take the lesion. See the screen, and we take the lesion at the same time. This is for the smaller lesion, usually less than 1 cm, 1.5, 2 cm. We will use this method because this is small lesion. You cannot take a big needle to take the big chunk of tissue.
So this is only if there is concern, like if you see something that you think maybe worrying. Okay.
So next is we call it two-cut biopsy, tissue biopsy. This will be a bigger solid needle. It's not a blood taking needle. It's a much bigger needle. Usually we use this to take a bigger lesion. Like for example, you can use a hand to fill the mass. Then you actually no need ultrasound guided. You can straight away take this needle and you can take the tissue biopsy straight away from the lung itself. So this we call it tissue biopsy or two-cut biopsy. Both are the formal investigation, but just this needle is too big to take a small lesion. This two-cut needle at least must have a size of at least 2 and above to take the lesion, or else you will miss the lesion. So these are the two important procedure further investigation for the BIRADS 4, 5 lesion.
Okay, so this is post ultrasound lah.
This is a post ultrasound.
Not necessarily what follows ultrasound on a normal patient, meaning someone who's got no concerns.
So usually we'll do under ultrasound also can, no problem. Okay. So we won't overshoot, we will take exactly at that lumps and take the tissue and send for the investigation.
This tissue biopsy thingy looks quite scary.
But actually we do it every day actually. The most important is bilateral communication. We say bi-way communication. You understand fully, I explain to you. Okay, you wish to take it, I will proceed. If not, that's the next option. Sometimes some patients say, I'm not comfortable with these lumps. Even you take this tissue biopsy, it come back as a cancer or non-cancer, I also want to take it out. So we will straight away proceed to so-called excisional biopsy. That means it's also want to investigate, but straight away we remove it. But that will be under, we need to give you some sedations. We need to give you some agent medication to sleep. Some patient will be worried, say, if this is this is not a cancer lesion, I will keep it and I don't want. So they will proceed for the needle aspiration. So this,
If surgery is needed, then it would be a surgeon
yeah,
maybe carrying
the
out
surgeon
this.
will refer to our surgery colleagues. We will do a bilateral communication. Anytime work as a team, actually, we don't work alone. So usually we will
Yeah.
consult each other for the further investigation. Yeah.
Yes,
Okay.
of course. Okay.
Okay. Yeah. So to conclude my talk today, actually, I would say imaging is just a part of the clinical assessment. We stand alone, we work as a team, especially in Colombia, Asia, we work as a team. Anytime we call each other, okay? And imaging is not a confirmatory test. We need to take the tissue to let our colleague in the laboratory to process and to see whether this is the cancerous or non-cancerous. So imaging just to act for the diagnosis. If you see something suspicious, we will do something to confirm that lumps is cancerous or non-cancerous. So imaging basically can play three functions. One is diagnosis. You come screening, nothing, you go back, you feel a lump, you come screening, something, we make a diagnosis. This is cancerous, for example. So we will do a procedure using imaging ultrasound to take a tissue biopsy, send for our colleague to investigate. Okay, and after treatment, okay, let's say this is a cancer. After you remove the cancer, okay, 1 year later, after you recovered fully, you'll come back again to follow up. So these are the three purpose of the breast imaging. Okay. So last message I want to all of you is I have 5 sisters actually. I do tell them everyone need to self-examination. Okay, you might be embarrassed with me. No worry, do self-examination. Very important. So usually for a lady who not yet menopause, okay, you might feel not comfortable to do self-examination during menstruation. I will recommend 1 to 2 weeks after your menses stop. Okay, you have a hot shower, your body will a bit more relaxed. You put more gel and start to examine during your shower time. Because if you examine with the dry hand, cold air, you feel not comfortable. Also, I will recommend you shower a bit, or you put body lotion and start to examine. And yeah, they will be more practical and more comfortable. And self-examination actually is quite accurate. My previous experience. Okay, and my training was in University Kebangsaan, Malaysia. So our hospital, all our professor, they are consultant. They do examine themselves. So even they found a small lesion, very small lesion at the very early stage, or 0.5 cm, 1 cm, they can detect it because they examine every month. So something unusual, they easily detect it. So this my message to everybody. Self-examination is very important. If you're not sure how to examine, okay, you can search in the online or YouTube a lot of video. Or actually, you can come to us or go to nearby health clinic. They will have a nurse who can guide you and teach you how to do self-examination. Okay, I think yeah.
Okay, great. Thank you so much, Dr. Khor. Okay, just to recap discussion just now. So you're saying that your recommendation would be for women to go for the screening,
Yeah.
mammogram, depending on their age, or ultrasound, like if they
Yeah.
are if they are below 40, right?
Below
Mammogram is
40, above. Yeah. Above 40. Yeah.
some men actually get breast cancer, as I
Yeah.
understand. So how do you detect breast cancer in men? Because mammogram, I suppose, would be really tricky.
Yeah, I don't think we're able to do
Of
mammogram.
course, yeah.
We need some breast tissue to compress it with the pedal.
Yes.
Ultrasound will be very accurate to assess the breast cancer in the man group. So I personally I do see two cases. One is younger, one is a middle-aged man. So ultrasound is good enough for us to make a diagnosis for the male population. Yeah.
Right. Okay. So what is the if you were to put like what is the percentage of um, definite diagnosis through mammogram and ultrasound? So which is the one that is more correct lah. Atau it depends
Mm,
cases.
because our aim to see how to say, let me recap it like this. Mammogram is usually read by the consultant radiologist. So we
Yeah, yeah.
due to phlegm, usually it's
All
not
right.
a problem for us to detect from the
Right.
mammogram. Ultrasound
Yeah.
sometimes is not done by us. Ultrasound sometimes is done
I see.
by the staff or some trained staff. So it actually also depends on the experience of the trained staff. Okay, but usually, like for example, in Columbia Asia Hospital Bintulu, we are working each other. The staff don't themselves. They will consult us immediately. We will go immediately to see if we found something suspicious. Also, no worry regarding the accuracy of the diagnosis. Definitely, for me, all the time I'm here. So I even tell the patient who found suspicious lesion, you can come evening time. I'm here until 5 p.m. Anytime you come 4:30, 4 o'clock, evening, I spend a quality time and explain to you your report. So that will be more reassured to you. Yeah.
How long does it take? Mammogram and ultrasound.
Mammogram, I think 15 minutes will be done. Ultrasound also is around 10 to 15 minutes. Depends on what kind of things we found. Usually normal thing, very fast, no problem. We
Okay.
usually for me, I explain to everyone who do mammogram. I call them to my room. I explain to them
Yeah.
what is the changes. I show them the similar film as I show you
Yeah.
earlier. Yeah,
Right.
so they understood. They will be more reassured. They will be more comfortable after go back. So, but if for this who have something
Mm.
have something abnormal which need further investigation, I will spend my time to explain to them. Any part might be short, 15 to 20 minutes,
Yeah.
but sometimes I even spend to half an hour to explain to them. So I want to have a quality time with them to explain my reporting part. This from me. Yeah, yeah.
Okay, great. So it sounds simple enough and it doesn't take much time. So there's
Yeah.
no excuse really. Women should go for breast
Yeah.
screening, whether
Yeah.
it's mammogram or ultrasound. I think I would leave that to the judgment of Dr. Khor. And of course, if you
Yeah.
heard the talk earlier, it's above 40 is mammogram, below 40 is
Mammogram.
ultrasound. Yeah.
Yeah.
Okay,
Ultrasound.
so thank you
Okay.
very much, Dr. Khor.
Thank you.
You to the audience out there, please, any of you living in Bintulu or the surrounding
Yeah.
areas, you can always go to Columbia Asia Hospital Bintulu to and purchase the packages that come either with either both for ultrasound and
Yeah.
mammogram or individually.
Yeah.
Okay, well, all right. Thank you so much, Dr. Khor, for your time, and thanks
Thank
everyone
you.
for being with us today.
Okay.
Thank you.
Thank you.
All right. Bye.